You can also watch us. We are on your computer, your mobile device. Just head on over to SuperTalk TV. I know many families are kicking off those summer sports and practices, particularly this week as June is up and going. Man, school will be back in before we know it. So joining us today is Dr. Derrick Burgess. He is a board-certified orthopedic surgeon and a sports medicine specialist, and he's here to get us ready for summer and back to school, kind of, sort of. But welcome back, Dr. Burgess.
Thank you for having me again.
Gosh, last time you were here, we were gearing up for, was it fall sports?
I think it was fall sports.
And football and all the things in that nature. And now they've had a little bit of a break, and they'll be heading right back into their summer practices, which can kind of be a shock if some of them have had several months off or a couple of weeks off and with the heat. So how do you help families sort of look at this transition into practices, and are we even allowed to have two-a-days anymore? I don't even know if that's a thing anymore, Dr. Burgess.
Well, with school going back so early, that two-a-day period has definitely been decreased. Yeah. And to be honest, the off-season has really shrunk down for many sports. As you mentioned, the beginning of June, now for like high school sports, basketball, football's working out. You know, a lot of the different sports actually work out during the month of June and play games during the month of June. So one thing I tell parents, for many parents, this is the time where you may be able to get a little break, unless you're playing like travel sports or you have multiple kids, different ages doing things. But it's a time where the kid can actually focus on being healthy. You know, they might be recovering from an injury that they've been just kind of nursing through the season. So this is the time to recover, the time to focus on your nutrition, your mental health, and the time to really just focus on being a better athlete instead of just having to go to practice to prepare for the next game.
You mentioned the word rest.
Yes.
It feels like that is an anomaly these days, particularly with things like travel ball, and it feels like you can pick one sport and do it all year if you want. I mean, I think we would both be advocates for kids to be active all year. That's something we definitely want. But when you say rest, is it rest from a sport? Is it complete rest? Is it, okay, can rest be if they're football players, they pick up basketball too, and I know in some of the larger schools they can't be competitive at both in season, but what is your definition of rest for that student athlete?
Well, I would love for the athlete to have time to just do nothing, but we know that doesn't happen very often. Now, as far as recovery and being able to cross-train, I think that's very important as well. Many times we see very subspecialized athletes at a very young age, meaning they play the same sport 2 or 3 seasons of the year. What the recommendations are that they at least have 2 to 3 months of the year where they are not playing that same sport, whether they're playing another sport or whether they're just training or doing off-season workouts to allow the body to recover.
I was going to say, so like first thing that comes to mind would be young boys and girls who pitch in either softball
Correct.
or baseball, but that would be like sort of the primary kind of niche market. So for the parent who thinks, well, they'll get left behind if they don't do X, Y, and Z, from your perspective, what would you say to that?
There's a lot of pressure. Parents are under a lot of pressure. Kids are under a lot of pressure because they see their neighbors, they see the other kids on the team that might be playing on multiple teams at the same time, or they go from the school season to a travel season. Many times during school season, they might be on a different team, or even on the weekend. So their pressure is there, and their pressure is real. So we cannot ignore that. But what we see a lot of times is that kids that start off really early playing the same sport year-round, playing on multiple teams, by the time that they make it to high school, when it's really time to shine, many of them lose interest.
They're burnt out,
They burn out or they're injured. And many times some of these serious injuries that I see in 12 and 13-year-olds, you don't ever completely recover from.
Because if we think about that next level, which you also help with at Jackson State, you're on their team, their sports nutrition, but sports medical team. How do they, because they would be at the peak of their athletic performance. You would by that time in their life. So their football players, their baseball players, their basketball players, are they doing this? They have their season and then they cross-train and do other things, but not that same sport all year?
Yeah, so they have off seasons, true in-season, off-season. So many of the athletes are now reporting back to campus for off-season training. And that doesn't mean putting on pads, tackling. They're cross-training. They're working on physical lifting, nutrition. They're working on, many people, I saw them yesterday, and I said, wow, you've really shaved off a lot of weight. And they said, really concentrating on my health and nutrition and doing a lot of physical activity, running, swimming, doing things that I don't have the opportunity to do, stretching even doing Pilates or ballet in some instances, to really,
go boys.
Right, to get your body ready for all the things that it has to take during a long season. So what we often do is compare our young athletes to professional athletes. And what we don't realize is how much support many of the professional athletes and major college athletes have, and our children don't have that many times.
I couldn't agree more. And I also recognize that many parents also find the travel and doing all the things as part of their family, experience, and it becomes their social too. And so it just gets real sticky real quick when you talk about the health of the athlete. But I would say, man, just seeing those telltale signs, and you talked about too, injury recovery is the summer being a good time to do that and rehab. And we know kids bounce back so quick, or at least we think they do when they're younger, right? It feels that way. Yeah. Definitely different when you're in your 40s and bounce back from a little sprained ankle or maybe some muscle tension. What are those red flags, especially from kids who play that one sport over and over, that may be like, hey, maybe this is a time that particular body part, knee, elbow, shoulder, something, we really need to give it the rest that you're speaking of, Dr. Burgess, versus just you're fine, ice it, keep going.
Yeah. So for an athlete or for a parent who is visible at the game and watching the games every day, you can tell when your child or your athlete is not performing, especially if they're limping or if they're complaining every practice or when they come home, if their joints are showing signs of swelling, especially for pitchers and catchers, if they're hurting. The main rule is don't throw when you're hurting, because it can go from an isolated shoulder injury to maybe now a shoulder and an elbow injury. So things that we catch early and start to treat early on usually have a much simpler path to recovery than when they linger on for a long time.
Is their first stop their pediatrician if parents have questions about a student athlete, or when should they see somebody, like you, like an orthopedic or physical therapy or something of that nature?
Yeah, so I think it depends on the severity of the injury. If it's really severe, you're heading to the emergency room or urgent care right away. It depends on what you can get into quickly, because with some insurances, you have to go through your primary care doctor, or you have to see a pediatrician before you can see an orthopedic surgeon. As an orthopedic surgeon, especially with sports, we want to try to make the entryway as easy as possible by setting up same-day appointments, by being able to have mid-level providers, nurse practitioners, and physician's assistants that you might be able to get in to see that same day, because we know the importance of that early diagnosis.
Well, too, if it's got to that point, you don't want it to be a 2-3 week out kind
Correct.
of, appointment with that. When it comes to the heat, I know in terms of nutrition-wise, hydration is a huge thing in keeping you safe. But does the heat impact like the accessibility to injuries at all? Does it change? Like, do athletes get more injured in the summer versus, say, in the winter?
So I wouldn't say the heat with injuries, but we do see heat-related injuries,
right,
or heat-related illnesses. So being in the summer heat, you have to stay hydrated, and that doesn't just mean drinking water. It definitely doesn't just mean drinking a sports drink or an energy drink. It means eating well, because we know many times.
Say it louder for the people in the back.
You'll eat your Skittles and maybe a banana, hopefully, and then you come to practice and you're out there for hours and you wonder why you can't perform, because your body needs the fuel to perform. So that's very important. Making sure that you not only drink when you're playing the sport, but you're staying hydrated throughout the week and you're having a well-balanced diet.
That's one of the best tips, too, for kids who do tournaments and travel ball. When it's hot, they don't want to eat, but still finding something, whether it's just lots of fruits, lots of yogurts, lots of salty snacks like pretzels and things like that. They're still light that they can get in. Makes all the difference in the world in their energy levels, their performance, but also keeping them from having any of those heat-related illnesses. And the signs for those people should not take lightly, correct?
Correct.
Yeah.
Absolutely, especially if you're starting to see any altered mental state, or if the person is really profusely sweating or stops sweating, or if they become disoriented in any kind of way. You want to pull them from the activity, get them, even before they go to an emergency room, get them immersed in a cold environment, an ice bath if it's available, to really decrease that core body temperature, because that can save brain cells.
Keeping our kids safe and more with Dr. Burgess coming up next. Nice. We are continuing our conversation with Dr. Derrick Burgess. He's a board-certified orthopedic surgeon and sports medicine specialist, and you work at UMMC during the day. So what's your day job, Dr. Burgess?
So my day job is very interesting. You might catch me on the sidelines. I might be in the operating room or in the office seeing patients, and I think I never have a bored moment at work. So I really love the diversity of the things I can do in a week's time, or even in a day. I might be in all three settings. So I take care of athletes, I take care of weekend warriors, I take care of just people with regular joint pain. So it's a very diverse group of people. I say usually from about 8 to 80, any span of that.
This would be interesting or I guess you're unique for a surgeon. Most surgeons don't have the diversity in their daily work and sort of practice. Is that just unique to you because that's the way you've liked to build your career? Or in orthopedics, is that unique to the profession that you still get to practice in all these, in the surgery, in the operating room, but versus in the community and around?
I think that's really unique to sports medicine because I take care of athletes on the playing field. I see athletes in the field house. I see athletes in my office. I work on athletes in the operating room. So almost anywhere you'll see an athlete, I'm going to be there. So that's something that sports medicine, and I work with primary care sports physicians. I work with athletic trainers, physical therapists, all that makes up the sports medicine team.
What led you to sports, Dr. Burgess?
So I had an injury in high school, and I had early exposure to an orthopedic surgeon. My orthopedic surgeon said, hey, if you're interested in medicine, come hang out with me. And I took him up on that. I continued to go back during high school, college, medical school. He became a mentor for me. So the early exposure kind of lit a flame, and I just continued to chase it, and I finally conquered it.
Well, even if you're not an athlete, getting the right physical therapist or orthopedic or all of the above can really improve your quality of life, your well-being,
yes.
Those daily acts of daily living, I'm going to get it out right, when you can move better. And I think that's important to know, too. You guys have a unique thing going on there. Y'all are starting something new in research. We've mentioned here on Good Things how Mississippi has really paved the way in terms of telemedicine, telehealth, really fast-forwarded during, obviously, the pandemic. Other states were really scrambling. We were one of the only states that are already set up for that in terms of health care, which I think is really cool. And it seems like Mississippi's still just expanding on that in the unique ways. So what's happening in your department?
Yeah, I think one thing about Mississippi that is very unique is that we are so scarce with providers that we have to be creative in the way that we can reach communities that don't have health care, especially from a specialty standpoint. So we have athletes all over the state. Every day I have somebody that drives 2.5, 3 hours to an appointment. So how do I provide the same level of care for them as I do for my people in Jackson, Madison, Ridgeland? And we're coming out with a telehealth rehabilitation program. So what we're doing right now, it'll be launching later on this month, is for my ACL patients. So you come in, you see me, you get a diagnosis that you have an ACL tear.
And what is that?
So
if someone's had it, they're like, let me tell you.
Right, I'll tell you. So anterior cruciate ligament, which is one of the main stabilizers of the knee. And we see this injury many times in cutting and pivoting sports, soccer, basketball, volleyball, jumping sports where you have to land. And sometimes when you don't land correctly, you can tear that ACL. It takes
one time too, right?
Only takes one time. And it's like a split second, and it changes your career. So when they come in and get this diagnosis, before we have surgery, we do prehab, where they go to see a physical therapist to do modalities to try to decrease the swelling, improve their range of motion, get back to walking normal, and then we have surgery. Many times this does not happen because the athlete or the patient does not have access to physical therapy in their small town or wherever they live.
And they can't come to you. They can drive 2 hours daily.
I cannot tell you to drive from Clarksdale to Jackson for physical therapy. It's not going to happen.
Right.
So now they will be able to enroll in this program and begin their physical therapy, whether it's prehab before surgery or the regular rehab after surgery. And for that first 3 to 4 weeks, they can be in this program where they're on the phone with a physical therapist, and there's a program where it actually can track their range of motion, track the different exercises they're doing, instruct them on how to do it properly so they're not uncovered. So we're really excited about this, and the technology is amazing.
Because when you think about like telehealth, I mean, yes, you can meet your dietitian. I know there are services for that. If you just have a cold or a cough, something that can be diagnosed that way, you make sense. But it feels like physical therapy would have been one that it would have been a hard hurdle to break through. But with the technology there, I would think certainly for things like prehab or post where it's just getting up in those range of motions, it's like, why hadn't we thought about this before, Dr. Burgess? But I'm sure it's been thought about. It's just been years in the making of getting the sort of technology there. So I know in terms of UMC, that's a research-based center here in Mississippi. Will this be being studied for other places to replicate or for it to expand?
That's the goal. Once we can really figure out how to best implement this platform, we want to do it on a broader schedule.
When I think about surgery and orthopedics, Dr. Burgess, I think there's two types of people. There's one who want to do everything they need to do to get the surgery to feel better fast. And then there's other folks, like some of my family, who will kick the can down the road and put off getting knees, hips, all the things that they know they need to do. And in fairness, Dr. Burgess, there are a lot of real reasons that keep people from wanting to do it. But they finally have it, and then they think, gosh, I should have done this 10 years sooner. For those who have the knee or the hip or have been told the destination is replacement, sooner better than later for those type of things?
So there's a spectrum of treatment, but once you reach that end stage, once you reach that end of the road where they say, okay, we've tried therapy, we've tried injection, we've tried bracing, and it's not working. It's no longer giving you relief for your symptoms. You know that, and I know that. And your daily activities, your ADLs, your activities of daily living are being
word I was looking for.
affected, right?
Yeah.
So I tell a patient, you will know when it's time to have surgery. You might not want to know, but you will know when you wake up and you're in pain and you cannot do the things that you want to do, or your family's going on a hiking trip and the only reason why you can't go is because that trick knee is not going to make it. At that point, it's probably time for surgery. So I think a myth is that if you go to see an orthopedic surgeon, you're going to have surgery. But truthfully, the earlier you present, the more options we have for you. But once that deformity is there, or once you have blown through all the other treatment options, surgery early on is probably going to give you the best outcome.
I would think in terms of technology, if you're basing your potential knee or hip replacement on your grandmother's or your mother's, then things look a little bit different these days. I'm not saying that you're going to bounce back and you're going to be a spring chicken within 4 weeks, but like it's not. It has evolved.
Oh, definitely. Technology's improved tremendously in the last 10 to 20 years with orthopedics. And most patients will come in and they will have a horror story. Their church member, their family member, they had a knee replacement and they never walked again, or they had something, they were not better. But research on these techniques that we do, they're really researched for years and years and years. So we can give you a percentage of, hey, 90% of people get better after having this procedure. And the science is there. So
my mother-in-law fell into that camp, Dr. Burgess, and she finally went and got both hips replaced as she was supposed to, one, and then the other, and should have done it 10 years prior, is what she said in terms of her daily living was just improved, her mobility was improved, and it was, just a good thing. And you think, because you mentioned if you're waking up in pain every day, if you're limited in what you're being able to do, and there are ways that you can safely and comfortably, fix it. Fix it. I would say that too, though, also with things that don't require surgery, right? Like there's so many listening to good things, Dr. Burgess, that has what they would call, the old man back or old lady knees or like their shoulder that just need proper movement or therapy. It would give them such a better release on life, and they baby it so they stop moving. What do you say to that? Yes,
I'm an advocate for physical therapy, and many times patients will come in and say, I don't need to go to physical therapy. I can do it at home. But they do not really realize how much goes into physical therapy. Not only the exercise part, but the other treatment modalities, dry needling, ultrasound, different things that physical therapists can do that you do not have access to at home. And most of the time, accountability. I tell people that are really busy, I don't have time for physical therapy. Well, are you going to do it on your own? Yeah. Sure, I'll try. But it's just like when you go to work. You clock in, you clock out. If you'll give yourself that 30 to 45 minutes where you go to physical therapy and it's done and you can go about the rest of your day and you know that you've done something to help yourself. I think that's really important.
I think that's really important, too. We've got more with Dr. Burgess. He's got a podcast. We'll dive into that more coming up next. That you can find us too on that local SuperTalk Mississippi radio station, but don't forget about watching us, which you can do on your computer, your mobile device. Just head on over to SuperTalk TV, continuing to talk with Dr. Derrick Burgess. He's a board-certified orthopedic surgeon and a sports medicine specialist, but he also helps people optimize their lives in many different ways. And one is, we were talking about, I was saying that if you have been told you're at the end of the line and you need surgery, right, that you should do it sooner than later and get back to a full and healthy life. I do recognize, those listening, there are many reasons why you are putting it off, but we also know the outcome of a good and successful one can bring you many more years. But there's a lot that goes into optimizing you, getting you ready to that point. And so I want to, it's not like just necessarily pushing you towards like saying yes to the necessary surgery if you've been told that, but making sure that you are prepared for it when it comes. Because some of you have been told that that's where you need to be,
correct,
but that there are some goalposts between you and that particular opportunity.
Yeah. So I think one common surgery that might require optimization is a joint replacement. Mm-hmm. So for instance, if you need a joint replacement and you want a joint replacement, you might be told, hey, you need to lose weight. Or if you have diabetes, you need to have better A1C control, mm-hmm, better control of your blood glucose. Or you need to have your blood pressure better controlled. So many times surgery, getting ready for surgery, is a process. You might have to go back to your primary care physician. You might have to be referred to lifestyle medicine, mm-hmm, so that we can have different people looking at you from different perspectives. Some people come in and they're ready for surgery and you can sign them up right away, but some people need more of a tune-up, so to speak.
So help the person out there that's been told that, Dr. Burgess, particularly what I see in my other life as a dietitian who works in that field with those that are wanting the surgery but have been told they either need to lose weight. Why is that important? Obviously, they've probably been told before that if they lost some weight, their knees would feel better, which I wrestle with. Yes, that is true, because there's the number you could probably say, however many pounds you lose is pounds of weight off of your
sure,
of your knees. And then some will tell you that they've weighed this weight their entire life and their knees have never hurt before. And so, it's like the chicken or the egg, which came first. But from the recovery standpoint, why is it important to hear what your doctor is saying in terms of the prep for surgery?
First, it's a very difficult conversation, especially if the person is not open to it. So I think first, as a provider, you need to gauge your patient's openness to losing weight, because I can sit up here and tell you all the things you need to do, but if you are not open to it, it's going to be a waste of my time and your time. So I think the reason why we tell you that is because studies have shown that certain implants do better at lighter weights, that your risk of morbidity after a procedure can be decreased at certain different weights.
You live longer.
Right. You live longer. And you might have lower risk of developing blood clots or wound infections, things that can really get you off path for your recovery, a healthy recovery. So we're trying to get you in an optimal state is really what it's about. And really trying to help you as a patient overall versus some people come in and they just want surgery. And I say, hey, I can make your knee nice and shiny. It doesn't mean you're going to be better as a person. So if you've been sitting in a wheelchair, maybe part of that pre-op optimization is getting you into physical therapy, getting your joints moving. If it's stiff going in, it's going to be stiff coming out. So we need you to be as strong as possible, as limber as possible. So that's why I encourage my patients, even if you're pushing through pain, try to keep moving as long as possible.
It's crazy to me, Dr. Burgess, it's just the amount of people who, and it's not like, oh, you're lazy, you could be working really hard, but your job just may be where you don't move a lot, or it may be that you did get an injury, so you're not able to do your physical activity like you enjoyed back again. But it feels like after your 20s or 30s, we just end up sitting. Right? And I've heard the thing that sitting's the new smoking, and that's kind of like a real, billboardy kind of thing. But that simple act of just not engaging in movement or physical activity, I would say at any age, but even earlier in your 30s and 40s, what are you setting yourself up for later on?
Yeah, I think if you stop moving early on, the likelihood of you getting back started at an older age is definitely less. And we know that osteoporosis is linked to low weight. is linked to people not having good strength. That's why exercise is so important. That's why a good balanced diet is so important. And we know that after a certain age, you're losing bone density. So one of the main things, even for women, is to do resistance exercise, to lift weights, to jog, to walk, to do the exercises on a routine basis, at least 2 or 3 times a day, for 30 to 45 minutes. That can make a life difference for you.
Okay, so what if you're listening, though, to good things, Dr. Burgess, and maybe you are in your late 50s, 60s, 70s. I bet we got some in their 80s listening to us today. Is it never too late to start with the movement, a proper, safe sort of movement, exercise, walking, stretch bands, chair yoga, I don't know, all the things. Can you, if you feel like you've dug yourself in a hole with your lifestyle, can you dig yourself out at any age?
Yes, I would say that you want to do it carefully. So I would ask that you go to see your physician first to make sure that you're healthy enough for it, and then maybe enroll in a class. There's different classes through physical therapy or through the YMCA or community health centers where they have instructors that will be able to specifically make a program for you. So don't just say, hey, I have not worked out in 5 years. Let me go get a membership and just start doing the same workout I did in high school. You have to be smart about it to reduce your risk of injury. But doing the movement many times is going to be better than not doing anything.
Also, too, we were talking earlier about physical therapy, and I know you guys at UMC have started great research on virtual PT, but physical therapists are a lot like any other healthcare provider. I have heard some people say, well, I didn't mesh well, right? Because it is, especially if someone is throwing your leg up and down and making you do all these things, sometimes personality match matters.
Absolutely.
Should you give up on physical therapy just because you and your physical therapist didn't match?
Correct. Absolutely not. Just like if your physician doesn't mesh well with you, go out and find a different physician. If your therapist is doing things that you don't like, number one, have a conversation. And if that doesn't improve, then there's plenty of different places that you can go to. But do not give up on, I tried physical therapy one time and it did not work. I hear that many times. Like, what did you do? How long did you do it? Oh, I went for 2 sessions. That's probably not enough.
It was probably uncomfortable for a reason, right? And if you feel like we're badgering you today, I'm not. These are the things that I see on a daily basis, and the sooner that you can start making those smaller changes and getting into those movement patterns, we can keep you out of Dr. Burgess's, OR, which would be really nice. I mean, you've got enough reasons for patients lining up, but prevention would be the key. And I think, when you ask yourself just how much have you moved, or can you move the same way you did 10 years ago, those would be honest questions to ask yourself. And
Sure.
It's not going to get any easier, but you can get back some range of motion. You can get back some of that quality of life. For those that may have those, sports injuries from the past and when they were at their prime in high school, can they get back to a form of physical activity safely? Because that's another thing I hear often is, well, I hurt my back. They told me not to lift weights, or they told me not to do this, and they told me not to do that. And I know, I'm not your doctor, so I don't want to speak, but how do you handle injuries, like old injuries?
Sure. So I would say if you have an old injury, go get a new assessment because many people will come in and they'll tell me about that injury that they had their senior year of high school, and they are 65 years old. But at the same time, many things that could have been missed, even if it's been bothering you for many years, it does not mean that you cannot be helped. So if you've been hurting for a while, it does not mean that you have to hurt for the rest of your life. So I would encourage you to be assessed by someone who knows your body. Go see your physician, and they should be able to help you in some kind of way.
And if they, and I know coming up too, we'll be right back starting football season and all of that. We've been talking about those that are older in years, Dr. Burgess, but also you work with a lot of student athletes and youth, and y'all have clinics and things open. So if people want what you're doing or see you or any of that, how do they get in touch with you?
Yeah, so as you were mentioning, as the football season starts, we'll have a Friday night walk-in clinic. I am in clinic several days of the week, but we have a sports medicine team. So we have someone present to be able to serve you almost every day of the week. So don't hesitate. Don't just sit around and be in pain. Come out and see us, and we can help.
Can they ask to be referred to you if that's what they choose to do?
Absolutely.
Can you do that? Can you? I feel like you have to ask permission, like in terms of talking to your healthcare. Sometimes people need to be given permission to advocate for themselves and what
Absolutely.
they want. Yeah.
If you want to see a specialist, Many times you will have to go through your primary care physician, but if you feel that there's a higher level of care needed, have that conversation.
All right. Well, I've enjoyed this conversation, Dr.
Thank
Burgess.
you.
All right. You guys stick with us. We got more for you coming.